Thank you all for coming tonight. It's great to see such a turnout to be able to help what I like to think is a good cause, and I hope you guys will as well. My name's Dr. Shannon West. I'm the Clinical Director of the Emergency Department here at the Animal Referral Hospital. Tonight I'm just going to kind of go through a presentation with you over the process of blood donation, why we're doing it, how you guys can be of benefit, and even who you're helping. And then after the presentation, Danny was one of our casual nurses was kind enough to bring Polly in, and we'll actually I'll actually take a unit of blood from Polly. So those of you that would like to actually see the process can understand it in its entirety. I also do appreciate that some of you might not be so keen on seeing the blood taking process, so that's perfectly acceptable as well. And if we get a chance later on as well, hopefully I'd like to show you guys through our practice as well, and show you a bit of the behind the scenes, assuming that we are actually open tonight, and so they may be busy downstairs, so that could preclude us from going around. But yeah, there's been a few changes here at the Animal Referral Hospital in the past couple of months with additional specialties coming on board. You may have noticed, if you've been through it all in the past couple of months, that there's quite a few renovations going on, and so it's not as neat as we would necessarily like around the place, but there's some pretty cool toys downstairs that are the benefit of having a busier, larger specialty hospital. All right, why greyhounds? So there's a few reasons behind why we like to use greyhounds over any other breed of dog, and one, I suppose, looking at it from a purely objective clinical sense, is their high, what we refer to as hematocrit, which is the percentage of red blood cells that they have in their blood. So as we can see up here, a typical dog will have a percentage of red blood cells in the order of about 35 to 55% of their blood, the rest being made up by plasma. The advantage that greyhounds have is they've essentially been bred as elite athletes over the past 2,000 years, and to be able to function as elite athletes, they have a much higher proportion of red blood cells, and in their case, most of them average around the 60% mark, and we have seen dogs even up as high as the 70% mark. The reason that dogs get a transfusion typically is because they are lacking in those red blood cells, and so being able to give them a transfusion of blood that has a much higher percentage of red blood cells means that it's going to do more benefit to them. It also means that we need to give them less as well, so there's more to go around, for want of a better term. Then the other couple of reasons that we come across with greyhounds is they're a nice large breed dog, and so they're large enough to provide us with a standard 450 ml unit of blood without it being detrimental to their health at all. Someone posted on the Canberra Times' website yesterday afternoon saying, "Oh, greyhounds have been through enough already," which is certainly true. Why can't we be using small white fluffy dogs to provide our blood donations instead? And yeah, exactly. Yeah, I'd either need to use 10 or 20 of them, or potentially the one dog that gives the 450 mils is not going to be looking that great afterwards. So. And the other reason that we obviously use greyhounds is a reason that is known very well to all of you guys already. They're lovely, placid dogs. They're generally very laid back, certainly compared to a lot of those small white fluffy dogs, and so they're much more amenable to be giving blood, and they're more willing to tolerate us taking blood from them as well. And as I put down the bottom there, because they're elite athletes, they have massive veins, and so it's easy for us to actually be able to take essentially get a needle into their vein and take a sample without it posing any risk to them. All right, so let's talk about the ideal donor now. Some of these things were covered in that questionnaire I handed around to you guys earlier. We want any donors that come through here to be fully vaccinated. So against their usual C3 and ideally kennel cough as well. And the really important thing that we want to make sure is that they're on regular heartworm prevention and that they always have been. Heartworm, as the name suggests, is a worm, a parasite that in its adult form lives in the blood. It's actually spread by mosquitoes, and they spread it by essentially sucking blood from one dog and then going and sucking blood from another dog, and the actual young larvae of the heartworm can exist in that blood, and that's how it's passed along. And so it's certainly a parasite that is of concern with regards to transfusions, because it is something that can be spread from a donor to a recipient. So we do need to make sure that they've always been on heartworm prevention. They need to be between 1 and 8 years old. Ideally, probably a little bit older than 1, more towards the 18 months to 24 months there. And we draw the cutoff at 8 years, and they're starting to get on in age at that stage, and while they may still be completely healthy, there is, I suppose, the increased risk the older they get of having age-related illnesses and organs not functioning at 100% capacity now, which means that they can function perfectly normally on a day-to-day basis, but we don't want to put them under any further stress by going and taking some of their blood from them, so that's why we draw the cutoff at that stage. Ideally, the ideal donor should be over 28 kilos. There's kind of a bit of leeway in there between about 25 and 28 kilos, and certainly so we're willing to let dogs into the program that are over 25 kilos at least. Even if they are under 28, so long as they're in good body condition. They haven't recently come from a trainer that's treated them poorly, and they're 25 kilos because they're quite emaciated. Ideally, a good donor needs to be good-natured and docile, which, as I said before, for the great proportion, greyhounds are. But I have occasionally found in the clinical setting, while they don't tend to pose a risk in terms of aggression that some other breeds do at all, they can sometimes be wusses, let's face it. And I don't want to be further stressing a dog that is fearful in a clinical setting, and so. If you're concerned that your dog does get a little bit stressed with coming to the vet and having handling or anything like that done to them, they may not be the ideal donor. And when it actually comes to running the program, when we get them in for the first time, when we go to take that first unit of blood from them, if we find that they don't react well at that stage, we may say, look, it's not really fair on Polly or whoever to be putting them through this, because it's only going to make not so much, as much the process of donation in the future a bit more scary for them, but also the visit to their usual vet as well. And so their general practitioners like Delwyn at the back will certainly appreciate it if I don't go and scare the jeebus out of their dog and make it harder for them to go to the vet again in future. And we do aim to make it a enjoyable process for them, so there'll be lots of treats, there'll be lots of cuddles, and we'll take it slow and make sure that they're comfortable with the process as well. So obviously we want our donors to be in good health. So any underlying pre-existing conditions, look, some things may be fine and won't have any bearing on the donation process. Look, off the top of my head, say a dog that's starting to potentially becoming a bit arthritic, for example, shouldn't. Arthritis shouldn't preclude us in any way. But if other things, let's say a mild kidney insufficiency, we'd certainly look at avoiding things like that. And the other thing that's kind of a little bit hypothetical, but ideally we want to be using the best candidates possible, is allergies. Now, more than likely it's perfectly safe to use a dog that has allergies, whether they be allergies to food or environmental allergens, but hypothetically there is the potential there that they could actually pass an allergy on to a recipient. And so that is something that may preclude them as well. It's all hypothetical. It's never actually been shown to be an issue in dog donations, but certainly in people there was one case of someone picking up a severe peanut allergy, a young child getting a severe peanut allergy after having had a unit of blood from someone that had a peanut allergy. So better to be safe than sorry. So dogs have, like humans, have a number of blood groups, but the advantage is they don't have the the stringent rules that humans do in terms of donating between groups. There's about 7 or 8 blood groups in dogs. The only one we get concerned about is the dog blood group DEA 1.1, and if they are DEA 1.1 positive, it will preclude them from being a donor, because the recipients are likely to have a reaction to their blood. Then the next item down there as well is if you have a bitch that has been used as a breeding dog in the past. If she's had 2 or more litters, we'll also look at precluding her as well, for the same kind of reason that pregnant humans can't give blood. She may be DEA 1.1 negative, but if any of her puppies are a different blood group to her, there is hypothetically the potential that she may have developed antibodies to their blood groups, and so we don't want to then go and give her blood to a dog that may be that blood group, because then essentially the blood in the donor sample may have a reaction to all the rest of the blood in that dog's body and cause a potential reaction. And for the same kind of reason, in terms of getting antibodies from previous exposures to different types of blood, if in the unlikely possibility that your dog has personally ever received a transfusion previously, they can't be used as a donor either. So the process itself, before we actually get to taking the blood, what we'll do is run a few tests on the dogs first. So first time donors will be blood typed, just to make sure that they are DEA 1.1 negative. That's actually a question I forgot to ask you. Polly has been tested? Excellent. I did check the next line down with Danny before. And when they first come in, we will actually run a basic blood panel on them, just to make sure that the major things are all functioning okay, kidneys and liver, no diabetes, things like that. And when we actually take the sample from them, we will check that hematocrit, both to make sure that they're a good candidate and to make sure that they don't have any underlying anemia at all. Now, most dogs will require some degree of sedation to help keep them calm and relaxed, as Polly has fallen asleep there now. while we could, in a lot of dogs, we could potentially get away without this, it's safer to give them just a little bit of something anyway, just to help calm them down, especially in some of those younger, more excitable dogs that have a couple of people around them and just want to jump around and play. We want them to stay as still as possible for the process. And the other thing is part of the sedation does have a small amount of analgesia, so a very low dose of something similar to morphine in it as well that lasts for a short period of time. So essentially, it's not a painful process for them as well, because, yeah, as I said before, occasionally they're not the bravest of dogs, and we don't want them to have a negative experience from the process. All right, so then we take what would be considered a standard unit of blood, being 400 to 450 mils of blood. We take it from the jugular vein, which is a normal site of taking blood in any dog. It's a nice big vein, and you get a good blood flow from it, and so there's no risks of the blood clotting as you're taking it, and hence we take that site. And then once they've actually given their donation, which only takes 5 to 10 minutes typically, if that, we will then have them on IV fluids for a short period thereafter. Give them a full bag of 1 litre bag of IV fluids to essentially replace the volumes that they have lost in the donation process. And so many of you may have noticed Polly limping around before because she decided that her leg was broken. There's certainly no existing injuries there. I've just placed an IV catheter in her front leg ahead of time, so that once she has actually given a bag for us this evening, we can hook her up onto the IV fluids to give that to her afterwards. And so look, I'm envisaging the whole process to the first time you guys come in, there may, like in terms of taking just doing a couple of blood tests beforehand, may take an additional 15 minutes or so, but the whole process I'm envisaging should only take in the order of 20 to 30 minutes, I would say, in terms of actually getting them in, giving them a bit of sedation, taking the blood from them, and then getting them onto IV fluids. And because they've given that sample, we can give them a bag of IV fluids nice and quickly afterwards so that they're not stuck in hospital for a prolonged period of time. Now, I appreciate, having spoken to some of you, that a lot of you don't expect anything out of this apart from the reward of helping save the life of someone's pet, but it certainly makes us feel better if we are rewarding you in some way for doing it. So what the plan is at this stage is that each time a dog donates a unit to us, you'll get a 12 kilo bag of the Royal Canin large breed adult dog, suited obviously to greyhounds. If you happen to have a dog on a specific different diet, it's a little bit difficult for us to kind of get an individual bag for each individual dog. So while I can't provide you with something different, you could then redonate the food on to the Greyhound Rescue Association would be what I thought. And then we've had these dog tags made up for them as well, which those of you that bought the paper copy of the Canberra Times yesterday may have noticed notice on Polly's collar. In the photo there, it was actually cut off on the online one, but on one side of it says "I save lives," and on the other side it says that they're an ARH blood donor. So you get to display that they're helping out other dogs. In terms of frequency, ideally we don't want dogs to donate more than every 3 months. Although them giving up to monthly is perfectly safe, we'd prefer to stretch it out. And given the amount of you that have actually got back to us about it, about the program, I would envisage that it would probably be even less frequently than every 3 months. In the past couple of years here, we've gone through an average of 25 transfusions a year. Now, that doesn't necessarily directly correlate to the amount of bags of blood that we require, because we do kind of require a reserve, and unfortunately we only can keep it for 4 weeks, and so some of it does get thrown away at the end of that period. So, but even if we require 30 or 35 bags a year, it might only be every 6 to 9 months that hopefully will require a donation from your dogs. And depending on the time of year, we typically try to keep 1 to 2 bags in stock at a time, and Murphy's Law would say that we actually ran out last night. Thankfully, we didn't require a second transfusion throughout the night, although it was looking like it could have been a possibility there. But there, you would have noticed on the forms that you filled in there that some of you, if you would be happy to kind of go onto our emergency register, so that if we had a unusual weekend where we used up a couple of bags and then had a third animal come in that required a transfusion, that you'd be willing to be available. You'd be called at 2 a.m. in the morning to rush down here to save another dog's life. So this is just the cover my backside area of the talk. As with any medical procedure, there is always a slight degree of risk associated, and taking a blood donation is no different. Having said that, the risk is very minuscule, and I'm personally yet to see any complication associated with blood donation, and I would say fairly confidently that I have probably been involved in more blood donations in Canberra than any other vet, given the nature of our work here at the emergency centre and our much higher requirement for blood than general practice. So there is a risk, but I've certainly never seen anything occur. The main risk I would hypothetically expect to occur if we had a donor with an undiagnosed clotting disorder, and we essentially took a blood sample from them. They developed a large hematoma on their neck where the blood failed to clot after the donation. Realistically, it's not going to happen. If your dog had an issue like that, it would have been detected at a previous stage in its life. Typically, when they're desexed, they may have had complications at that stage. So, while I've got to mention it, and it's always a possibility, realistically, it's not going to happen. Getting on to why we're actually doing this and who you're helping. I've got a couple of case studies here of a couple of patients that we've had over the past 6 months or so. Coda's a German Shepherd. I think he's about 8 years old. I've seen him a few times over the past 5 to 6 years for various issues. Some of you, I suppose, owning greyhounds to some degree familiar with the condition bloat, are you? Coda came to me back when we were still at Braddon, having had bloat and actually needed his stomach derotated and surgically stitched to his abdominal wall to fix the problem at that stage. But he came back to us about 4 months ago. Because he had a cancer on his spleen that's super common in German Shepherds, unfortunately, and the reason it occurs in the spleen is because it's a cancer of blood vessel origin, and the spleen is full of blood vessels, and the problem is when these blood vessels become cancerous and grow, they have the potential for popping and bleeding, and so he was actually bleeding internally. He came in collapsed and his gums were really white rather than the nice pink colour from all the circulating blood. So he received a unit of blood, and our surgeons were able to remove his spleen in emergent surgery, and they were able to bring him, quickly rebound him back to being in better health. Gib is a young West Highland White Terrier that came in to visit us because his owner had noticed that his urine had blood in it. We again found that his gums were really white, and having questioned his owners, it turned out that he'd got into some rat bait 5 days earlier. Blood tests confirms that he didn't have the normal ability to clot his blood. Some of you may be familiar with rat bait and the risks it poses to dogs. It is essentially a drug that interferes with one of the clotting factors and can cause bleeding disorders. The problem that rat bait poses compared to other potential toxins that your dog can get into is that it doesn't have an immediate effect. It actually interferes with vitamin K, and the production of vitamin K, which is the clotting factor, and the body has about 3 to 4 days reserve of vitamin K, and so people will see a dog get into rat bait and think, uh-oh, I'll keep a close eye on him, and if anything goes wrong, I'll take him down to the vet. They'll watch them for 12 or 24 hours, and they'll be perfectly fine in that period, and they'll think, oh, we've got away with it, it's fine. It's actually 4 to 5 days later that they'll actually then have life-threatening problems when they start to bleed, potentially internally, so the owners won't even notice it occurring. So Gib got a transfusion. A blood transfusion. He got some vitamin K to replace that which his body wasn't producing. We closely monitored him overnight, and then he was able to go home essentially in good health the next morning. He needed to go home on to 6 weeks worth of oral vitamin K because that's essentially how long the rat bait stays in the system. It interferes with the production of vitamin K and potentially the period of time that it can pose a problem to them. And finally, this is my cat Jojo. Jojo has saved 15 lives and counting. Jojo's been the clinic cat here, was the clinic cat here from a kitten, and he's about 7 or 8 now. So he's getting a little bit old to be giving blood anymore, but over his life he's given 15 transfusions. And so just recently he's actually come to live with me in a quiet retirement now that he can't give blood anymore.